Okay, welcome to today's webinar, Medline and MedlinePlus for librarians. Our presenter today will be Zach Young from Frontier Nursing University. We will open Zach's slides for him, and welcome to Zach.
Thank you so much, Tricia. Thanks, everybody. This is a lot of fun. I'm normally getting to deal with a lot of nurses, so it's nice to speak to some other librarians. Today, we're going to cover Medline and Medline Plus. These are two databases offered by the National Library of Medicine. Medline is mostly for researchers and practitioners and librarians. Medline Plus is for consumers and consumer health information. So we'll take a look at both of these and see what sort of things could be useful to you and your patrons. So first off, what is Medline? Well, it's the largest biomedical database of articles in the world. You've got over 33 million articles covering medicine, veterinary sciences, nursing, dentistry, etc. They have their own proprietary subject headings, and if you're familiar with databases like I assume you are, you should be familiar with thesauruses and subject headings that are attached to some databases. Well, Medline has their specially named one called MESH, medical subject heading. So basically, every article of all those 33 million articles that get put into Medline, there is an indexer at the National Library of Medicine that assigns a special subject heading or subject headings to that article. And it's fantastic for helping us narrow down our searches. And I'll talk more about that here in just a few. It can be searched, Medline can be searched via multiple interfaces. You may be familiar with PubMed. PubMed is the National Library of Medicine's own interface for searching Medline. Normally, if you Google an article title, like a medical article title or a health sciences article title, PubMed will be one of the first links that pops up. And if you click on that link, oftentimes you'll get the abstract, and sometimes you're lucky and you get a free full text of an article. But most times it's going to ask you to pay a little bit of money. And we know that our patrons absolutely despise that. So what I would recommend you do is if you or your patrons, if you see them or you use PubMed, Google PubMed Outside Tool. And this is a tool that PubMed offers that allows you to hook your library's online journal holdings to PubMed so that when patrons use your PubMed link to search Medline, if you own a copy of the article, you get a special little button in the top right that allows your patrons to access that. So once again, that's the PubMed Outside Tool. They will help you set that up, and our students absolutely love it. But what I'm here to talk about today is the EBSCOhost version of Medline. And this is what most of you all are familiar with. And if you're dealing with nursing students at your public library or whatever library you're at, this is probably what they've seen before. If a student or a patron went to a traditional four-year institution, they more than likely use the EBSCOhost interface. Now, here's a bit of an issue we're facing. We found out this year that EBSCOhost is completely revamping their interface. So today's goal in the past was to actually show you some Medline searching, but I've realized that's probably not a good idea because of this change of interface. So in just a couple of months, we're saying goodbye, old friend, and we are saying hello to the new EBSCOhost interface. It's a lot cleaner. It looks a bit more modern. We are currently in the process with our systems librarian of customizing ours, and this is an early look of what our EBSCOhost version of Medline will look like. And yours will look similar to this. We still have those very familiar 3 search boxes that everybody loves in EBSCOhost. You have the ability, of course, to add fields. Let me grab a pointer here so you can see. So you can add fields if you want to add extra search boxes. You also, what I really, really like, and just let me go back a slide here. If you notice at the top of the old interface, you had a lot of buttons up here, including the Mesh 2024 button. Clicking on this link took users to a separate web page that oftentimes could be a little confusing because they're not actually, when they use that web page, they're not actually searching for an article. They're searching for a subject heading to use in their search. And honestly, that confuses a lot of our patrons. So the new way they're doing it is they are putting mesh on the same page as the regular search boxes. And I think that's a good move. I think patrons are going to be able to see that, click on it, not immediately be taken to a new web page, but instead use the current web page to input their mesh terms without feeling like they've gone on some wild web hunt looking for an article. So we're fans of this right off the bat. We've already started picking out our customizable limits option here. And we find when we're using Medline that some of these limits are just essential every time we search. And I'll talk to you about some of those right now. For example, this human limiter is essential in Medline. We have seen students searching for articles and they will turn in a research article, and the population used in that research study was cows, not humans. All right. You will find articles about veterinary sciences in Medline. So you want to make sure that you are using this human limiter when available. Another one I like to stress, especially for our students, is the English language limiter. Of course, as librarians, you're familiar with this, all right? And some of your patrons may want articles outside of an English language, but if you're working with nursing students in your library or any sort of student and they are doing an assignment, 9 times out of 10, it needs to be in English simply because we don't know what languages their instructors speak. So English language, we find that essential as well. And then the last one I really, really like, and I'll explain why, is abstract available. This is something that confuses all sorts of researchers, including some of our faculty. What they will do is they will find an article that they absolutely love because of the title. They'll click on it, and it turns out it's a book review instead of an actual article. Or it's an editorial talking about an article, or it's commentary on another article. It has a sneaky title that looks fantastic, but once you actually open up the full text, you see it's a letter to the editor. Abstract available gets rid of all of that stuff. It gets rid of book reviews. It gets rid of commentaries. It gets rid of editorials, things that can get in the way of people finding articles that they want. Okay. So we're liking the new view so far, but I'm not going to be able to show you any searching on it. What I want to offer you, though, is a link or a screenshot, and I'll provide the link to this later, to the FNU Library YouTube page. We are in the process of creating new videos that are specific to the new EBSCOhost interface. Included in those videos will be an introduction to searching in Medline, an advanced searching in Medline, an introduction to searching in CINAHL, and an advanced searching in CINAHL. These videos are done by Carla Townsend. She's our information services librarian at Frontier. She has the most soothing voice of anyone I've ever heard in my entire life. Carla used to be a hospital librarian, and she puts together a fantastic tutorial on how to search these very complicated databases. So please check out our YouTube page, and in the next couple of months, we will have videos ready to go on the new EBSCOhost interface. I also kind of want to highlight some other stuff on our YouTube page, if you don't mind. We find that no matter what type of patron we are dealing with, whether it be an alumni who is practicing, whether it be a student, whether it be one of our faculty members, there is always a need for showing folks how to search for clinical practice guidelines. This may be a term of those that are not in the health sciences are familiar with, but basically clinical practice guidelines are what your doctors and nurses are using to help guide their practice. It's the evidence behind what they're doing. These clinical practice guidelines are produced by large medical organizations like the American College of Obstetrics and Gynecology or the American Association of Nurse Practitioners. They produce these guidelines which highlight the best evidence available that your practitioners read to dictate their practice. So staying current with what the latest guidelines are saying is essential. And we've got a video here showing folks how to find that information. All right, so please check out our YouTube page for those videos and the new videos we will be having. All right, so that's Medline. It's kind of an update on where it's at, where it's going, and how you can get some more information on it. But now I want to move to Medline Plus, okay? So the name is confusing right off the bat. It's something that confuses our students, and it's something that confuses the general public. If you are aware of what Medline is, and then you hear the term Medline Plus, you're like, oh, it's like a subscription version of Medline. It's just a better version of Medline for practitioners. No, my friends. Medline Plus is completely different. It is aimed at consumers and consumer health information. It's going to provide reliable current information on health topics, medications, medical tests. It's designed for the general public and healthcare professionals, but with a focus on the general public. We'll talk about what the differences are in some of the entries in just a second. My favorite thing about Medline Plus is absolutely no advertising. And in my opinion, if you are looking for health information on the internet or just information in general, you want to find a source that does not have advertising. And why is that? As librarians, we know, but sometimes we have to explain it to our patrons. And that's because of bias, right? If there's advertising on this webpage from Pfizer, right? If there's advertising on this webpage from Pfizer and we are looking at a drug entry for melatonin, all right, and Pfizer produces Ambien, there could be a little bit of bias there. Why would a webpage advertising for Pfizer would allow the content on the webpage to have anything nice to say about melatonin? That would be a conflict of interest for them, right? That's bad for them, but good for you. When there is no conflict of interest, you're just getting the essential information. The other thing I love about Medline Plus, content is free and it's available in English and Spanish. That is fantastic. Sorry about my dog there. Let me shut my door. The fact that it's available in Spanish, it blows my mind. And I believe that all consumer health information should be available in Spanish. So much of our populations that are coming into our public libraries are solely speaking Spanish. To be able to offer them this as a public health resource is fantastic, okay? Not only does it provide it in Spanish, we'll talk about some of the other languages that are available in Medline Plus in a few. The whole Medline Plus website in general is really focused on the idea of health literacy. And this is probably a term you've heard before. Some of you may be very familiar with it. And I know all of us are familiar with the term information literacy. So health literacy kind of falls under information literacy. And it's basically a person's ability to interpret, analyze, and make decisions with their knowledge of healthcare topics. And when we write these topics, or when they're on the web, when they're in pamphlets that we hand out to patients, when they are in little worksheets that we put up, they need to be written at a certain level. And the Agency for Health Research Quality actually has puts a number on it. They say written materials should be written at a 4th to 6th grade level. They need to use short sentences, simple words, and provide evidence-based instructions. They should include pictures, okay? And the AHRQ actually has a full tool that you can use online and download that will allow you as a librarian to evaluate any health education material you are providing to your patients. And we'll provide that as a link as well. So it's essential. The thing with health literacy, and I believe this to be the case, the thing with health literacy is that you could be the smartest person in the world. You could be the best computer scientist. You could be the best lawyer, a fantastic engineer, and have a very low health literacy level. And it's not your own fault. It's just because you don't live in that field. You didn't study that field. So no matter what type of patient what walks into someone's office, you can never assume that they are going to be health literate. So that's why written materials need to be at a 4th and 6th grade level. Um, so that's a great assessment tool that you can use on your current health information or health information that you're going to be developing for your patients. Medline Plus has a whole section on these tools, on material that meets the standard of these tools. Let's take a look at that real quick. So in Medline Plus, on their homepage, they're going to have a link to easy to read health information. You can search through this list, or you can access it through the various alphabet that they have at the top here. So this is information that has passed that assessment that the AHRQ has provided. All right, well, what else does Medline Plus have? Check out this. This is located on their homepage near the bottom. You're going to get information on health topics. You've got a medical encyclopedia. You've got information on genetic conditions and genes, information on drugs, information on medical tests. You've even got healthy recipes. And take a look at the bottom here. Health information available in multiple languages. I clicked on that the other day and counted over 50 different languages. No matter what patron is coming into your library, assess what language they are using, and you can find health information for them by using that link. I think that is absolutely fantastic. Let's dive in to one of these health topics real quick and talk about what it actually offers. So I picked a health topic on anxiety, and here's the information you're going to get. Okay, what is the condition? What is anxiety? All right, you're going to get that written out in a nice, easy to read format. What causes the condition? Who's at risk for this condition? What are the symptoms of this condition? I can't tell you how many times I have Googled symptoms and just gone down a rabbit hole. I know we are all in that same field. This is authoritative information on what the symptoms are. So you're not reading someone's Yahoo Answers post telling you that your health condition is way worse than it is. All right. How is this condition diagnosed, and what are the treatments? These are questions that are easily answerable, that you may not think to ask your doctor while you're with them, or your patron might not think, but they can sit down later, check out Medline Plus, and read through this stuff. All right, so that's the health topics. So after health topics, what else do we have? We've got drug topics. Now this is a whole business in and of itself. Drug information. I know here at Frontier Nursing University, we pay a lot of money for our students to have access to very in-depth drug information tools, tools like LexiDrug, tools like Hippocrates or Micromedics. This is a consumer health information database variant of that. So you can look up drugs. You can see, why is this medication prescribed? How will it be used? You can see off-label uses or other uses for this medicine. Are there special precautions I should follow? What side effects are there? All right. In case of emergency or overdose, I've oftentimes sat down to take my medicine in the morning, 3 o'clock rolls around, and I'm like, guess what? I totally forgot to take my medicine this morning. I take it again. All right, I've done that. I could see myself needing in case of emergency or overdose. All right. It has, what other information should I know? It's got the brand names listed out. They're going to put important warnings at the top, and they're going to give you tons of information on your drugs. Now, this is not just FDA approved drugs, okay? This is going to include herbs and supplements as well. And I know that almost everyone that goes to see a healthcare practitioner these days is on some sort of supplement. So you can get your supplement information here as well. What else do we have in Medline Plus? This one to me is probably the one that hits closest to home and gives me the most satisfaction to use, because there is nothing that gives me more anxiety than a medical test. All right. So this page will have basically every medical test you could think of, and it will answer these questions for you. And as a person with white coat syndrome, it is essential for me. So one, what is the test? Okay. Two, what is the test used for? All right. Why do I need the test? What happens during the test, and is it going to hurt? All right. Do I need to prepare for the test? Can I, should I not eat 12 hours before? Do I need to make sure that, some other sort of stipulation is adhered to before I come in for the test? Um, are there any risks to the test? Are there side effects to the test? If it's an eye test, am I not going to be able to see for the rest of the day? I need to know these things. And then most importantly, I think this one, especially in the digital age, really is very important. What do my results mean? We are in the age of my chart. We are in the age of getting your lab results on the internet before you have had a chance to talk to a practitioner about them. You'll just see some numbers on the screen. Are those numbers within the range? Are they out of the range? This will help you interpret those results. I know my wife just went through this with her mother who had cancer, where my chart would come in and her mom, having a low level of health literacy, would look at the chart and just completely develop an anxiety episode because she didn't understand what those results meant to her. So in my opinion, this is one of the most useful aspects of Medline Plus, is checking out those medical tests. Okay. So we are wrapping up here, my friends. I've got some references about that personal health literacy definition, but I am definitely open to take any questions you may have on Medline or Medline Plus at this point.
Zach, what do you think are what are the most frequently asked questions or things that you would anticipate might, be encountered in the local public library?
Yeah, in the public library, you're going to get a lot of people that are coming in to ask questions on behalf of someone else. And when that happens, it's oftentimes going to be cancer related questions. And then, recently we had a rash of COVID related stuff come in. But for public librarians, I think you're going to be looking up drugs, and I think you're going to be looking up just health topics in general. One thing I did fail to mention on the health topics page, and I'll go back to that now, is when you do get these questions at the public library and you're kind of able to judge your patron's level of health literacy, like, are they able to kind of understand what you're telling them and what's going on? If that's the case, there are some kind of further steps you can take. There will be research sections on every health topic that can take you to places like clinical trials that are available for the condition, or current journal articles from peer-reviewed journals that are available for the condition. So as the patron comes in, give them your reference interview like you normally would, kind of judge their level of health literacy and address whatever health topic they're looking for. Oftentimes, the health topic question will then evolve into a drug information question or a medical test question. So being sort of flexible and starting broad with maybe the health topic, I think is probably the best bet for most of our public librarians.
When people come in and they have a question that's, um, kind of something that's current in the news, like if there's a, listeria outbreak or E. coli outbreak or something that's kind of just hitting local news, what do you think is the most trusted source to guide people to current information? Is there a current affairs kind of link in here, or is there another website that you think is a good, quick, try this one?
Oh, that's a fantastic question. My wife actually used to work in Frankfurt as for the she was an epidemiologist, and her job was tracking those outbreaks. So local health department, your local health department webpage or state health department webpage, if there is some sort of, like, I believe Costco just had millions of pounds of butter recalled. So your state health department webpage is probably going to be the best bet for that. That's a great question though. Or like when Chipotle had their listeria outbreak with the lettuce that broke my heart.
Right. I know there's another fast food restaurant that I've seen on the news. So that was just a question I was
Yeah,
wondering.
that's good.
I
Yeah,
can
state health department, they track that stuff. Yep.
gotcha. All right. Well, is there anything else that you think we need to keep our eyes or ears on, or any other parting thoughts that you want to share with us?
Well, yeah, as a librarian speaking to other librarians, we're in this profession because we love to help, and I want to help you. So if there's ever a medical question that you're unable to answer, you just want more information on, or maybe some guidance on, you're more than welcome to email me or any of the Frontier librarians at librarian@frontier.edu. We love helping our fellow librarians in Kentucky and everywhere else. So please don't hesitate to reach out, and we can share our expertise.
Thank you. And again, you said that's librarian@frontier.edu.
That's right, librarian@frontier.edu. And thanks so much for having me, Tricia. I really appreciate it.